We heard yesterday from the Prime Minister on this programme, the plan is for all adults to be given a COVID booster jab by the end of January. All people aged 18 and over will be offered this booster by the end of January 2022 because of the new variant Omicron. But the Health Secretary has admitted it's going to be tough to meet that target. Well, meanwhile, in leaked documents which have been seen by the BBC, scientists who advise the government say the impact of the new variant is highly uncertain, but may require a very stringent response. So do you believe the government is doing enough to tackle this? Well, one man we're about to hear from doesn't. Charles Persinger lost his wife and his mother to coronavirus. Charles says he wants answers from the government. There's a public inquiry into its handling of the pandemic that's set to start in 2022. Bereaved families have released a report highlighting the issues they want addressed. And Charles, as I say, is with me now. Charles, I'm so sorry for everything you've been through over the past year or so. Tell me what happened to your mother and to your wife.
Yeah, of course, Graham. Firstly, thank you for having me on the show. My nightmare really started all in January last year, this year, 2021, when I got a phone call. My mother had fell over and broken her ankle. Obviously, she was taken into hospital, where 14 days later, we were informed my mother had COVID-19.
She contracted it whilst in hospital?
Something the hospital doesn't actually admit to, but it's pretty simple maths. I strongly believe she contracted the COVID while she was in hospital. I can't see where else she got it. She was staying at home, isolating. She was aware of, she had early onset dementia, but not to the point that she didn't understand there was a deadly virus going on. And she was remaining isolated, and she would use a mask and sanitize and everything else, that she could do to keep herself safe. She had carers coming in to check on her and stuff like that, a couple times a day. On the whole, she was coping very well. It was very early onset dementia, but obviously when she caught COVID, she rapidly deteriorated. It didn't help her mental condition or her physical state. Eventually, she just grew weaker and weaker. She was quite elderly, obviously, 84 years old. With COVID-19, your odds aren't great.
You lost your mother, and then you just got through that nightmare. And then your wife caught it.
Yeah, my wife contracted. My wife was a assistant care home manager working in Swindon when the pandemic come, and I was actually visiting my mother in hospital as she was dying, while my wife was at home isolating because she'd contracted COVID from work. So she couldn't even come to support us. She was unwell herself. She basically went back into the care home because staff were becoming ill, patients were getting ill. It swept through the care home like wildfire. No other way to describe it. She was coming home telling me about the challenges these people were facing. Where they were getting pressure from an overwhelmed NHS to take patients back into the care home because they were running out of beds. Several other factors, lack of adequate PPE, lack of any mitigation really at this stage in the pandemic. This was during the second wave. This wasn't during the first wave. So we already knew we had to be mitigating, That didn't happen, that ring of steel that was meant to be around care homes never happened.
And your wife was taken into hospital, was she?
She was taken. I looked after my wife for about 4 or 5 days after watch my mother die. I come back, obviously. And I looked after my wife for about 4 or 5 days at home, the best I could. She started to rapidly deteriorate. I could see that. It was obvious. So, yeah, I phoned the hospital. We got her into hospital. That was a challenge in itself at the time, you know. It took several hours for an ambulance to be able to transport my wife. I mean, all credit to the ambulance crew, the medics, the nurses and doctors who cared for both my mother and my wife, because they did a wonderful job in that very trying circumstances that they still are today.
Charles,
it's just very sad. Yeah?
Your wife was in hospital and then you received a phone call. Tell me what happened.
Yeah. She'd been in hospital for quite a while. By this time, she was in there for about 2-3 weeks. I got a 2-minute phone call with my wife just before they ventilated her. I could hear the fear in her voice. She told me she wasn't going to make it. She told me goodbye. I told her I loved her. I said, don't be silly, you'll be okay. What else can you say, you know?
Yeah, I get that. Were you able to see your wife in hospital?
Oh, I got to go in and watch her die. I get to watch her. I went in and watched her take her final breaths, as she was struggling for air, The same with my mother. I got to see them both, and as odd as that sounds, I find that very comforting that I got to do that, because so many people were denied that opportunity, those last moments with their loved ones,
Charles, understandably, you have questions you want answered by the government. How do you think they could have handled this better?
Well, we all know now from, hindsight that they should have locked down a lot sooner, a lot earlier. When COVID was announced in China, why weren't the borders shut? They could have acted a lot quicker. I mean, even today, they're not. If I'm quite honest with you, we have children going into schools in unmitigated environments without HEPA filters, without masks, without vaccines. How reckless and irresponsible is that of our government not to be protecting these children at this moment? And we have a new variant coming in.
Well, we've been talking about this variant on the programme for the past couple of days or so. Omicron. What are your fears about this new variant?
Well, we don't know enough about it. At the end of the day, let's be overcautious. Let's take mitigation seriously. It can't harm, can it? It can only help. I would just encourage everyone, to get their booster jabs, get their vaccines if they haven't had it yet. Wear a good quality mask. A good quality mask is so important because COVID is airborne. Something that scientists did not announce. The government didn't announce it. The scientists gave them the information, The government didn't announce it soon enough. That's something that's just coming out. I believe science has known for a while that COVID's been airborne. I certainly have.
Well, a government spokesperson has said, and I quote here, "It is critical we understand what happened in detail, but at the moment it is right that public servants continue to focus their efforts on tackling the pandemic before moving on to the inquiry in the spring." What's your reaction to that? What do you say in reply?
Oh, yeah, that sounds like more stonewalling to me at the end of the day. I think for a fact the COVID inquiry will save lives. It's so important that we do it sooner rather than later. The government dragging their feet on this isn't helping anyone. What they're doing basically is dodging accountability. And at the end of the day, bereaved families do deserve answers, and we're not getting them. And, more people are dying, 1,000 people a week. An inquiry will help save lives. That's a fact, because an inquiry the whole point of inquiry is you learn lessons from it. and you move forward and you don't make the same mistakes again. But as far as I can see, the government are making the same mistakes. Everything they do, they're dragging their heels. It's half measures. There's, the example that our ministers are giving is absolutely appalling. When you're going to Barnard Castle and having parties without masks and not wearing masks in the Commons, yet expecting the public to do so. The mixed messaging, they're responsible for that.
Charles Persinger from Swindon, thank you so much for being with us on the programme. And again, I'm so sorry for everything you've been through, but thank you for sharing your story, your experience with us. Charles, who lost both his mother and his wife to COVID.